Hi everyone. Today we're deep diving into a topic that's absolutely crucial if you're considering a full arch dental solution, the material of your prosthetic. I've touched on this before, but I feel it really deserves its own dedicated video. When you're shopping around for a dental procedure that involves a prosthetic, you need to be an educated consumer. Price is important, no question, but equally, if not more important, is the quality and type of prosthetic that you're receiving. I want you, the patient, to ask your doctor this critical question. What type of prosthetic am I getting? Am I getting acrylic or am I getting zirconia? I emphasize this because unfortunately many providers who lower their procedure costs to attract more patients, which is perfectly okay by the way, are sometimes less than transparent about the type of prosthetic being used. This transparency is vital because when the initial price on day one certainly matters, what truly matters is the price over the entire lifespan of your procedure. And when you look at it through that lens, there's absolutely no question you should be getting a zirconia prosthetic. And ideally, never an acrylic one for a long-term solution. Acrylic prosthetics were incredibly popular about 15 to 20 years ago. Their popularity was mostly due to the fact that zirconia technology simply wasn't where it is today. But acrylic comes with some significant drawbacks. First, acrylic is a material that requires a lot of thickness for strength. This often means that doctors have to reduce more of the patient's natural bone that you'll never get back. Second, acrylic prosthetics have a higher rate of complications, tooth chipping, wear, and even some teeth falling out. And third, and in my opinion the most critical of all, acrylic is a porous material. That means bacteria tends to stick to it and accumulate underneath the acrylic, making it incredibly difficult for you, the patient, to clean at home, and equally challenging for us to clean during your office visits. This leads to a higher risk for implant bone loss. The results in my own cases comparing acrylic versus zirconia are simply no comparison. My cases with zirconia have a much better long-term outcome, which is precisely why I have stopped using acrylic in my office as a long-term fixed approach. Now, for a short-term temporary prosthetic, acrylic is absolutely fine. It's short-term. Those negative effects that I've mentioned won't manifest for years. But as a long-term restorative material, it simply does not meet the standard anymore. Zirconia, on the other hand, is now at the absolute high end of dental technology. New advancements in zirconia are coming out almost weekly with incredible results. It is significantly stronger than acrylic, which means we can make it much thinner and more comfortable. It is far more aesthetic than acrylic, blending seamlessly with your natural teeth. It does not wear down like acrylic. And most importantly, it's incredibly smooth. This smoothness is key because not only does it prevent bacteria from getting stuck on it, but your natural gum tissues actually adhere and stick much better to zirconia. This means you're going to get a much healthier, more stable, and aesthetically pleasing result. So when you're picking a provider, make sure you ask them directly, what material prosthetic am I getting? And crucially, ensure that the price you're quoted for is for a zirconia prosthetic. Think about the amount of appointments you'll have over the next 10, 15, 20 years, cleanings, addressing complications like chipping and wear, rebasing an acrylic prosthetic, fixing teeth, all of those issues plus significant risk of bone loss that could require placing new implants in a decade down the line. All of those potential complications and their associated costs goes down dramatically with zirconia. So make sure you pick a provider who at the very least offers zirconia, and I truly hope you make the right decision when selecting your prosthetic. Your long-term oral health and comfort depends on it.